Thank you for joining us for this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will discuss a well-deserved award received by someone we've grown very close to here in these press events. The mayor will also talk about Orange County's efforts in assisting the state with the vaccination process, including the reopening of the online portal. The mayor has information regarding COVID-19 cases and testing, the work of our strike teams, eviction diversion, and more. Orlando Mayor Buddy Dyer could not be here with us. However, Dr. Raul Pino from the Florida Department of Health in Orange County is here to discuss details on the vaccination process as well as COVID-19 trending in our area. We begin with Mayor Demings. Mayor.
All right. Thank you, Dr. Williamson, and thank you to all of you for being here once again. As we near the end of another week, this is our 110th press briefing since we began the briefings regarding the pandemic nearly a year ago now. But today we do want to recognize the Servant of the Year, recognized by the Central Florida Hotel Lodging Association earlier today, Dr. Raul Pino. So congratulations, sir. He will also tell you that there are other men and women who work in his organization that have made him look good over this period of time. That's the way it works sometimes. But we do appreciate the partnership with Dr. Pino and the Florida Department of Health here at Orange County. We certainly could not have had the type of successes that we've enjoyed with keeping the numbers relatively low of new positive cases within our community. We still have a lot of work to do, so we can't sit back and celebrate too much because the pandemic is still alive and well in our community, and especially with the variants that we now know exist here. Dr. Pino will talk about that during today's briefing as well. So as we move forward, each time we do a briefing, I try to share with you new news, good news and bad news, and so we'll start today. The good news, first off, was the recognition for Dr. Pino. Also, let me just share with you the Department of Health in Orange County has received additional doses of COVID-19 vaccine here for our community. On Monday, February 22nd, online appointments will reopen at 9 a.m. to qualified Florida residents who are 65 years and older. These limited appointments are for the Orange County Convention Center site only. For more information, go to our website at ocfl.net/vaccine for more information and pre-registration, again, for those 65 plus. That way, when we open it up on Monday at 9 a.m., you'll be ready to go. Also, starting Monday, the Convention Center will increase its capacity they'll be handling up to 3,000 individual doses a day. As a reminder, we say to all of the public, please bring your valid identification to show that you live in the state of Florida and your square or QR code with appointment details. If you have a confirmed appointment and do not have means of transportation to the Orange County Convention Center vaccination site, you simply can dial 311 if you are within Orange County to get assistance with transportation, or you can dial the full number 407-836-3111. An operator will coordinate with links for a possible free transportation option to the Convention Center site. There must be a 48-hour advance notice. So far, Links tells me that 30 individuals have availed themselves of this free ride program to the Convention Center. And now, let's talk about the numbers. Everyone pays attention to the numbers. Good news is that 44.9% of Orange County residents ages 65 and older have received at least one COVID-19 vaccine shot. That is really exciting news as we approach 50% of Orange County seniors getting vaccinated. Now, we still have a long ways to go for the entire county, but at nearly 45%, 50% is looking pretty good for our seniors. As for the total number of county residents who have received at least one dose of the vaccine, that number is 111,966 individuals, which is about 7.5% of our county population. So the converse of that is 92.5% of our population remains to be inoculated. So the gold standard for us is to get up to that 79%. So at approximately 80%, you can see we still have a significant ways to go with only 7.5% of our population being vaccinated. Earlier today, I participated in a nationwide conference call with White House officials, and they have continued to promise additional inventory and supply to the state and locals across the country. We heard that they anticipate increasing the vaccination sites for our pharmacies. We cannot say precisely what the inventory will be for those additional locations, but more information will likely come out as soon as tomorrow. They are looking at other federally designated sites across the country. We remain optimistic that we will get an additional federal site in our location, but we will wait on announcements coming as soon as tomorrow. Since the start of the pandemic, there have been a reported 110,824 positive COVID-19 cases in Orange County. 1,060 residents are reported to have died of the novel coronavirus. That's an increase of 30 deaths since our last briefing on Monday. Again, Dr. Pino will get into the details of the numbers. Again, we do offer our deepest sympathies to those families who have lost a loved one. We know that individuals still remain hospitalized in critical care, so there likely will be other families impacted. Our 14-day rolling positivity rate is 6.8%. Just as a reminder, we will continue to offer free testing 7 days a week at the Barnett Park location through at least the end of this month. We remain optimistic next week that Congress will pass the next stimulus round. At this point, the projection for Orange County is that we could see an additional $272 million for our county. So we are saying to our representatives that we support the passage of the legislation that will enable the additional allocations to be directly deposited within our county funds. So we look forward to that. Our strike teams remain committed to making sure that Orange County businesses maintain safety standards for both the patrons and employees. They are remaining active. So far, they have visited nearly 6,700 businesses throughout the county, and the overall compliance rate remains 99.2%. Since the citations and fine program began in December, nearly 2,300 businesses have been inspected, resulting in 128 warnings and 23 citations. So we are staying active. This is no time for us to let up on those CDC guidelines and protocols. In terms of our eviction diversion program, it has been a highly successful program. And just as a reminder that tomorrow we will be shutting down the eviction diversion program at 6 p.m. Any application currently in the system will be processed. Good news is, since our COVID-19 eviction diversion program launched 6 months ago, we have provided more than $11.2 million in assistance and helped over 3,500 individuals and families stay in their homes. To be exact, as of about midday today, 3,571 different individuals or households had benefited from our existing eviction diversion program. On March the 1st, we will launch our new Orange County Emergency Rental Assistance Program. We may refer to it from time to time as the ERA program. You know, you hear ERA sometimes associated with what? A real estate company. So it's going to be associated with our emergency rental assistance program. Information about Orange County's emergency rental assistance program can be found at ocfl.net/ERA. And now, the Servant of the Year, the one and only, Dr. Raul Pino, Director of the Department of Health in Orange County.
Thank you. Thank you, Mayor.
I like a drum roll.
Yeah. The update for today. So Orange County has so far 110,824 positive individuals during the pandemic. The last time that we had a press conference, it was 109,950. Our recovery rate continues to be high, it's 96%. And unfortunately, as the mayor mentioned, the number of deaths have increased to 160. The age range is 49 to 1,060. The age range is 49 to 97, with a median age of 77. Unfortunately, those are 30 additional deaths since last press conference. 14 were female, 16 were male. 14 are from January that have been entered into the record. So that continues to add to January being closest to the deadliest month of this pandemic. And 16 are from February. 37% had a residence in a long-term care facility. With regard to the variant cases, we have 14 that have been identified. They are all the UK variant, and the age range from 15 to 61, with a median age of 30. 9 or 64% are male, 36% are female. One of the 14 cases, 11 were investigated and 7 were interviewed. Of the interview, 1 reported out of country travel, and 6 reported no recent travel. So if the information is correct, it's safe to assume that those 6 acquired the variant within the area. 2 of the 14 cases are related into a household, so that's inside transmission. There are not reported death or hospitalization in this group so far. 3 of the 7 interviewed individuals did not have any symptoms. Also, there was a media question here last time regarding to the time that it takes us to get to those cases. So the days between the day that the case is identified and the day the variant is identified. For the jail outbreak, some updates. There are a total of 131 individuals, inmates, that has been infected. There are 55 that are currently in isolation, and the jail is also in lockdown for those areas that are controlling the pandemic. 26 correctional officers are also infected, and 16 of those are in isolation at this time. 4 of the buildings in the prison are affected, and the positivity rate is 5% among correction officers. I'm sorry, 5% among inmates and 2% among correction officers. For the vaccines provided, I want to give you some interesting information if the data is correct, and that's a caveat there, because that data needs to be cleaned constantly. So the oldest person that has been vaccinated who live in our county is 113 years old and was vaccinated in Brevard County, although, again, we are going to verify this. Is a female and she lives in Orlando. And the oldest person vaccinated in our county is 104. He's a male and was vaccinated February 10. We will contact both individuals, especially the lady who is of that age, because if that's true, she has experienced both of the pandemics, 1918 and 2019. So that will be an interesting conversation to have. The total number of doses administered in our county so far, 200,002,929. The total doses administered in our county to county residents, 178,055. The Orange County resident that at least have 1 dose is 111,966. And the total number of non-county residents that have been vaccinated here, 24,874. I know that number seems to be high, but I want to remind the public that many of the people who work in our county do not live in our county, and that could be the case. 7.5% of our population have been vaccinated. And for the 65 years and older, the mayor mentioned to you that is we have administered that vaccine to 134,124 individuals who are 65 years and older. That brings us out to a range in that group of 44.9, so we are getting close to the 50% in 65 years and older, and we probably can achieve it by next week. As the mayor also mentioned, today and tomorrow, the portal is going to open, or already open and already filled. The mayor sent a tweet today, and in 45 minutes, those appointments were filled. We went for today and tomorrow from 2,500 to 2,700 appointments. We want these to date with a higher volume to calibrate our systems in case that we find anything. As you may imagine, moving 2,000 cars in a space can get tricky. Without having accidents. And on Monday, we will increase to 3,000. We are expecting next week to be the full week to 3,000 appointments a day. Now, that doesn't mean 3,000 appointments. That means on top of the appointments that we already have for phase 2, we are adding more first doses. We were not directly affected by the weather with regard to the vaccines. Only 1,000 Moderna doses that were intended to be delivered here have to be returned to the sender, whatever that means in that lingo. But those 1,000 doses were not destined to be used in Orange County. They were destined to be held in here for further activities. With that, I will answer any questions that you may have. Thank you.
Okay, thank you, Dr. Pino. We do have from the school district, if there are any questions for them, Mr. Scott Howard has joined us. If there are any questions regarding the compliance team, Mr. John Weiss is here. If there are any difficult questions, Commissioner Gomez-Cordero is here to answer those. And if there are questions that need to be translated in Spanish, Ms. Elia Torres is here for that. Okay. All right. So we'll open it up. Any questions?
Lauren Seabrook, Channel 9. My question's for Dr. Pino. Dr. Pino, it wasn't that long ago when you all were only doing 2,000 people a day. You quickly moved to 2,500. Now you're moving to 3,000. Can you share how you've been able to decide that you can move up that way? What kind of changes maybe are being made, or if you're just kind of getting used to it at this point?
So if at some point of the day we are like this in the site, we decide that it's time to increase it. So what had happened, some people understand, we started at 1,500. Well, actually, the first 3 days, we only did 300, maybe 100 a day, 300 in the total first 3 days. And as we gain efficiencies and people are trained, because we have several shifts that go through it and contractors, so it always takes a little bit of time for people to get coordinated and to know what to do. The process that we have set up at the convention center is basically an assembly line kind of concept. And so all those pieces have to work together to be able to have the output that we need. I was checking today, we were doing about 260 an hour. So that is impressive and significant. But we will have not been able to do that without support from the county and our partners, and especially for all the help that we are getting from the Orlando Fire Department and the Orange County Fire and Rescue Department, who are also helping to vaccinate. So that gave us the ability to set up 16 to 17 stations, so we can vaccinate 17 and 16 vehicles at the same time, and that allows us to move this volume. Mm-hmm.
Buenas tardes. Para el doctor Pino, acá. Doctor Pino, ¿para cuántas personas va a estar abierto el portal el próximo lunes? ¿Cuánto tiempo podría estar abierto? Esa es la primera pregunta. La segunda es, ¿hay preocupación por los casos de la nueva cepa de COVID? Entiendo que son 14, pero hay preocupación por el subregistro, porque muchas personas, no se sabe si hay más casos al respecto. Y por último, la tercera pregunta, con el caso de la cárcel del condado, ¿cómo se está manejando esto y si realmente está bajo control los casos? Porque son casi 160 casos ya y va incrementando el doble a la semana pasada. O sea, ¿podemos decir que esto está bajo control, sí o no? Y le repetiría la segunda pregunta, en este caso de los casos, al señor alcalde, al mayor.
So I got 3 questions. It's supposed to be one. And Williamson will kick me for taking more than one. But I'm going to bulk it one. The questions were, where are we with the outbreak in the prison, and can we say it's under control? And on that one, we do not close any outbreaks until 40, in the case of COVID, until 14 days without any new cases. So as long as a case comes up, we will start the clock again. So in that regard, it's not under control, because under control would be when things are, come down without new cases. Now, what we believe is that will be soon under control. Our county jail has demonstrated through this pandemic that they have the ability to implement those measures. We believe that some of the transmission may have happened with some of the contractors. So sometimes this is out of your total control. It is a pandemic environment, and you try many things, but it's sometimes squeezing. And it's also the ability to respond and how you respond. So with that, we have full confidence that the county health systems and the inmates' healthcare services will be able to control the pandemic, and we are totally collaborating with them in that effort. With regard to the, I'm answering in English, it should be in Spanish. Ok, con respecto a la pandemia en la prisión, no podemos decir que está bajo control porque se necesitan 2 semanas sin ningún caso para decir eso, pero tenemos confianza completa en que las medidas adecuadas van a ser tomadas por las autoridades. Con respecto a las variantes, sí deben haber más casos, no debe solamente 14. La preocupación continúa siendo la misma y lo que tenemos es que continuar con las medidas preventivas que hemos tenido hasta ahora. The other question was about the variants and if there is any concerns with the presence. Yeah, the concern is the concern that these are more transmissible for what it had shown. But recent research has demonstrated that the vaccines are effective, against those variants. So what we have to do is to continue to protect ourselves, protect those who are around us, and increase vaccination rates as fast as we can. And that's why also we have decided to open with Advent Health for tomorrow another 3,500 appointments for healthcare workers, and they are going to stand at the pod. That announcement went yesterday. And tomorrow is Friday. Saturday, we are also conducting the second wave of the school employees who are 65 years and older. So with that, we continue to reinforce the need to accelerate vaccinations.
Okay, what I'm going to do is also respond to that question, and Ms. Ilia Torres will help translate for me.
El alcalde también desea responder a su pregunta.
And this is reference to jail. Today we have approximately 2,600 inmates at our Orange County Jail.
Con relación al asunto de las cárceles, en la cárcel actualmente tenemos una población de 2.600
And
reclusos.
it has held about 2,600 for weeks now.
Hemos tenido esa población por varias semanas ya.
The population that, this is a local jail, not a prison. So the individuals who are booked in our jail can be there from a few hours to a few days.
Hay que recordar que nosotros lo que tenemos es una cárcel, no es una prisión, por lo que los individuos pueden estar ahí por horas o por algunos días.
The majority are not there for months.
La mayoría no se queda en la cárcel por meses.
So it's a transitory environment.
Es un ambiente transitorio o de transición.
So the people in our jail come from our community.
Las personas en la cárcel vienen del ambiente de nuestra comunidad.
We told you today that the rolling 14-day positivity rate is approximately 6.8% for the population that has been tested.
Previo durante esta conferencia de prensa hablábamos sobre el promedio de nuestra comunidad, que en la actualidad es 6.8%.
And if I did the math correctly, Dr. Pino said we have about 161 individuals who have tested positive, some phase of recovery at the jail.
Si hice la matemática correcta, basado en la figura que ofreció el doctor Pino, tenemos 161 individuos en la cárcel con casos positivos.
That represents about 6.3% of the jail population.
Eso representa aproximadamente 6.3% de la población en nuestra cárcel.
So what you see in our jail is what you see in our community, and vice versa.
Básicamente lo que se refleja en nuestra cárcel es lo mismo que se refleja en nuestra comunidad y viceversa.
So it really is fairly extraordinary that we had not seen these types of numbers in our jail.
Es extraordinario que no veamos números más altos en nuestra cárcel.
So hopefully that helps to explain where we are with our jail population.
Esperamos que eso ayude a aclarar lo que está pasando en nuestra cárcel.
Okay. Other questions?
This is a question for Dr. Pino, Hadass Brown with WESH 2. So last week, you shared with us that a local college student had been identified as a variant case. In the weeks since, has any more information come in about that case, and has that college seen any sort of uptick in cases?
I don't have any updates on that, but I could bring that next week, for sure.
Thank you, Francis Merrill, for Radio Haiti Tropical. Dr. Pino, concerning the herd immunity, is that going to be a nationwide? Is that going to be on a nationwide rate, or state by state, or county by county? When are we going to know that we have herd immunity?
So that's a good question. I mean, you can go community by community, and you want it at 79% at least in the community that you are part of it. Each state or even each county or each district is a little bit different. It depends on socioeconomics and who get vaccinated. That's why the mayor and our team continue to make emphasis in the need to vaccinate people with lower access to healthcare services, transportation, low socioeconomic status. because these are the people who may have lack of access to healthcare services and therefore probably suffer the greatest consequences of being infected. But the reality is that there are many factors that play in the desire of someone to get vaccinated. And on that, if you allow me to, it is important for people to understand that you are hearing a lot about secondary effects of the vaccine, and there is a lot of talk about what's happening. So it is true that you have seen some secondary effects of the vaccine, but keep in mind that we are vaccinating millions of people in a very short period of time. So all the secondary effects that you can see in 10 years of vaccinations, you are going to see it in a few weeks of vaccination. That's why there seems to be so loud in the system that people are experiencing some side effects, and it's due to the fact that we are vaccinating a very large volume of people. Imagine some of the studies that were done prior to approval, the human trials for Pfizer and for Moderna, were 40,000, 60,000 people in those numbers. Orange County alone has vaccinated already 200,000 people. So it really multiplies the side effects. So with that, I encourage everyone to get the vaccine, independently of who you are or where you live. Please have access to the vaccine. As soon as your group is able to access the vaccine, access the vaccine. In this changing environment with the variants, it is important to get vaccinated as quickly as possible. Thanks.
I will add that there's a lot of inaccurate information, misinformation that's circulating about the efficacy of the vaccine related to the variants or to the virus as we know it today. So on Monday, we are going to bring in a physician, an epidemiologist who has been engaged in some of the research to kind of respond to the efficacy associated with the current vaccine and its ability to inoculate a human being from the virus as we know it today. So that will be part of the press briefing on Monday. Okay, where are we? Questions?
This is Sharon Stone with News 13. I'm not sure who the best one to answer is. You talked about, Mayor Demings, you talked about increasing capacity at the Orange County Convention Center. Does that make you optimistic that more groups will be able to get vaccinated soon beyond 65 and up, or is that even a county decision? Do you have to wait for the state on that?
Well, it's largely going to be, I think, a federal and state decision with local input about expanding the eligible group of individuals. We do hear some conversation about, as the inventory will increase next week and the week thereafter, a possibility of expanding the eligible group to include a small number of law enforcement officers who are going to be working at and have been working at various sites and perhaps some other frontline workers. But it truly is undefined. I have been on at least 2 nationwide conference calls today, and I have one more after this that I will participate in. So it's kind of a moving target at this point.
I didn't even see it sneaking up there. Amanda Dukes with Channel 2, and this question is for Dr. Pino. As you're increasing the capacity at the convention center, do you have a sense of what the current wait times are for people in their cars? And is that going to increase now that you're going up to 3,000?
That's actually a very good question. And I was thinking about an answer for that question in my vehicle earlier, so thanks for asking.
In your vehicle.
So yes, and we need a collaboration from our community partners and from the community at large. Right now, people are not waiting more than 25 minutes. And that's very low for this type of operations. So we think that it probably could increase a little bit. So people should be a little bit patient. We wanted to keep it on an hour, but we think an hour is a decent waiting time for 3,000 people a day that we are trying to move. So at the time that we are going to increase, people should come prepared to wait a little bit. They should bring water. We have restrooms. People should take the medication. Maybe it's wise to put some kind of fruit or food that you may want to eat if you get your sugar a little bit low. And again, I advise our seniors to take the medication as prescribed by the doctors before they come to this event, and come ready to wait a little bit. But it's true, the time wait could increase. But we haven't seen any increase today on wait, and we went from 2,500 to 27. But another 300 could add a few minutes.
Nikki Zizazo with News 6. My question's for Dr. Pino. Dr. Pino, some of the neighboring counties are saying that their vaccine demand has been declining. Here in Orange County, just from kind of what you've said, you guys are upping vaccines for a lot of people, and there's still a lot more people in Orange County that need to be vaccinated. What variables do you think you need to have to be considered in order for you guys to kind of see that decline? Is it just more people willing to take the vaccine? What would that be?
So it could be because they are coming here to get vaccinated from other counties, and that's happening, and that's fine. We are very pleased to be able to help our surrounding communities, and not only vaccinating, thanks to the investment that the county did, we also being able to hold all the vaccines for Osceola County. They are being held by us and the county for the cold change that we have. Also, we could see some increase in the number of vaccines that we are receiving in the area rapidly in the coming weeks. With regard to what goes into that, and I really don't have an answer. Every time that we open the portal, it gets full in 45 minutes. And that's what happened when the mayor was saying his tweet today. When Advent Health opened the portal last night or yesterday for healthcare workers, 3,500 appointments, it was full in 12 hours. So there is a demand in this community. Now remember, we are 1.5 million people in this county. It's different than the surrounding areas I acquired, not as large. So the demand is very high, and we have a very active population, and it's great to see that demand, really. We haven't had any lack of willing arms to get vaccinated. Interesting. We also have people faking to be old to be vaccinated. So yesterday, we realized a couple of young ladies can dress up as grannies to get vaccinated for the second time. So I don't know how they escaped the first time, but they came vaccinated, the bonnet, the gloves, the glasses, the whole thing. And they probably were in their 20s. So there's a lot of things happening. And we also have increased security around the site, and it's important for people to know that we have severely increased security. We saw some patterns that call our attention, and some people asking for vaccine to our nurses when they leave in the site. And this is the hottest commodity that is out there right now. So we have to be very careful with the funds and the resources that we are provided. So with the help of our mayor and the county, we added additional security to the site to deter any possible ill intentions that someone may have.
And Dr. Pino, you might also include that with the eligible group now primarily being those 65 plus, the fact that we have reached nearly 45% of that population in our county having been inoculated, that there will be some slowdown in demand within that group. Now, that in terms of the total demand of with all ages within the healthcare workers and the frontline workers and others, that demand still is significantly high. I don't think we have any shortage of people who desire to get vaccinated. We're only limited today by the lack of inventory. Would you agree that?
I agree,
That's
and
why.
we are the best site in the state, so
Yes,
that's why people want to come.
yes.
It's Orlando after all.
Hi, Robert Guadarrama, Fox 35. This question is for Scott Howlett with OCPS. Scott, as you know, 1 out of 10 OCPS students had 15 or more unexcused absences for the first semester of this school year, significantly higher than last year. Why does the district think this is happening, and what is the district doing about this?
Sure. So we think a lot of it happened because of the first couple weeks of school. We gave families flexibility in because they were on launch ed, on attendance. So you had some situations where families chose not to participate in launch ed and wanted to just come back to face, and so some of those absences built up over that time. We certainly have seen an increase in absenteeism. We're concerned about engagement of our launch ed students, consistent engagement with some of them. 1 in 10 versus 1 in 24 last year is a significant increase. We're continuing to monitor that. Those that received letters for low academic performance in January, part of that was because of attendance. The ones that were asked to come back to face, it's because of that engagement. So we've been working all fall, our guidance counselors, our principals, our social workers, in order to go out and identify those individuals that had missed a significant number of days or were absent a significant number of days, in order to bring them back, either on launch ed platform or face-to-face.
Danielle Lama with Fox 35. This question is for Dr. Pino. Dr. Pino, I have to follow up with these ladies who dressed up as the elderly. Did they have appointments? How did you guys kind of get to the bottom of this? How were they able to get in? And, is it frustrating to hear that someone's trying to jump ahead in line?
So, listen, our job as a health department is to vaccinate as many people as possible as fast as possible. Now, the governor has set up a priority scale based on CDC recommendation with a little modifications, and we do respect that. In their case, that was yesterday when I was leaving, and I haven't been at the site today, so I don't know all the details with regard to how they got in, where the first dosage with us. But they did have a valid CDC card, vaccination card. There were some issues with their IDs and their driving license, but I don't know all the details about that.
I love that story. This is Steve Hudak from the Sentinel, and wow. This is for Dr. Pino and for Mayor Demings. With all this talk about the expansion of the vaccine, who would you guys what groups would you like to see vaccinated next?
I think in my case, if I have a choice, I will be prioritizing law enforcement and teachers. But again, I don't make those decisions, nor do I make recommendations. So that's my personal opinion. Law enforcement, because we need them to be ready at any given time, and they are exposed, getting closer to many people who they don't even know their status. And they also go back to their families. So it's important for pandemic control, someone that moved that much within populations to be vaccinated. And the same applies to the teachers. Although we don't have that many teachers that may have acquired infection at the schools or from students, we know that the students tends to be asymptomatic, many, so that expose teachers to additional risk that they may not even be able to perceive because you can't determine that. If those decisions are made, we'll be more than happy to execute.
I would agree with Dr. Pino. The only perhaps group in addition would be, I'm going to say, those who are vulnerable because of health-related issues where they may have compromised immune systems or what have you. We still do not have, even though the hospitals are getting supply, we don't have ample supply. Daily, I get a correspondence from someone in the community who explains that they have a particular health condition. They're not yet 65, but they really feel that they need to be vaccinated. So I think that's how I would prioritize it, and somehow work with our physicians to identify that category of individual.
I know we're only one question, but
Yeah, that's
I have
right.
a quick follow-up on this because I think people are interested in this. Are you having a chance to have input with the state that would you like?
I will tell you that it has gotten better. At this point, we have the White House Health Equity Task Force that has a membership of 12 individuals from around the country, and then some various secretaries from the Department of Health, HUD, Agriculture, EPA, and others who are advisors with that particular group. Florida has one representative on it who is out of the South Florida, the Broward County area, Pembroke Pines, and I understand it's a student, an activist. They are engaging with community health centers, pharmacies, community grocers, and others to ensure that the vaccine is more widely available. So that is a decision that is being driven primarily at the federal level that is impacting the decisions within the states. And I agree with the decision of the administration, which is why I participate in these phone calls to give input. When decisions have been made at the state level, sometimes I felt frustrated because I did not feel that we were at the local level being readily communicated with. And so, you know, I've said that publicly on a number of occasions. I have seen improvement in that regard, but in all honesty, it's still not what it should be. And so we, on a daily basis, through our various conference calls, make known our desire to ensure that we have a voice in this process. After all, we all live in local communities. We're the ones who know the geography of our communities, the resources of our community much better. And so as an elected member of this community and as the Orange County mayor, that falls squarely within my sphere of responsibility and authority during a state of emergency within our county. And I hear daily now the promise that, yes, we hear you. We need to communicate better, federal, state, local, and they'll say tribal in our country as well. So I remain optimistic. I do see some adjustments being made.
This next question was texted from Ryan Gillespie with Orlando Sentinel for Dr. Pino. You're going to 3,000 vaccinations a day. What do you think is the most the Orange County Convention Center site will be able to handle in a day when supply allows for it?
I think that probably is very close to what we can handle. So that's why we are trying to reach our limit. Again, we don't want people to wait more than an hour, except when you have, issues here and there. System can go down, computers, power, those things can happen and that delays. But if things are flowing, we don't want people to wait more than an hour. So 3,000 is getting to that point. But now, when you say the county, that's one site. You also have Advent Health is ready to pop up a site that can do about 2,000 to 3,000 another individuals a day if the supply was there. So you have all the community health centers that want also to get engaged and vaccinate people, as well as many of our private providers and clinics around the county. So the numbers could be quite high. And the federal government is also looking into the possibility of putting FEMA sites around the country, and those are large sites that could handle 20,000 people a week. So if we are lucky enough to get one of those sites, that could add to our capacity as well.
Thank you. This next question comes from Peter Reinhold with News 13. Dr. Pino, can you say roughly how many cases you've seen of people misrepresenting themselves to try and get vaccinated?
Well, so there have been a few. They are all different and creative. There was another individual that had the same name of his father, came with a car, but different birthday. But, you know, we have access to a lot of information, so we can quickly verify who is who, where they were born, you know, anything that you can imagine we have access to. But I will not know. I think it's higher than we suspect, to be honest with you. As we are engaged in this process and try to move people quickly, some people could squeeze in. So it's probably higher than we suspected.
This next question comes in from Eric Mock with News 13. Dr. Pino, can you clarify, he's saying that you mentioned 1,000 vaccines that were delayed by the weather. Where were those going, or who were they meant for?
So they were going to be delivered to Orange County. Those were 1,000 doses Moderna, and they were on hold. Sometimes the state pre-positions vaccine dosage around the state for missions or for other counties that are close to us that may not have the capacity to refrigerate or to distribute. So with that, we always will receive an indication with the shipment. This is for you, this is for Osceola, this is for this is for to be hold. And that was the case.
And lastly, this is from Ryan Lynch in the Orlando Business Journal for geared towards Mayor Demings and Dr. Pino. Are you working on securing a location, a federal site here in the region? I believe Dr. Pino already kind of mentioned that we hope FEMA, but if there's any room to elaborate.
All I can say is that we have been told that announcements could be made as soon as tomorrow, and I'll leave it at that.
In our case, we are preparing for the eventuality.
Thank you. Thank you.
All right. If there are no other questions, once again, thank you all for being here. The next press briefing will be on Monday at 4:30 p.m.